I think the main barrier that I've seen to patients exercising, depending on the community that they live in. If patients live in a neighborhood that they don't feel it's safe, that's definitely a barrier. In terms of safety, most people have smartphones now. So find YouTube exercises that you can engage in, that you can do indoors in your home. The other barrier that I hear patients talk about is that they're so busy. I always tell patients, you know what? If you make something a priority, you will figure out a way to make it work. So if you say to yourself, exercise is a priority, exercise is particularly important, then you figure out a way to make it work. If patients work long hours during the week, I tell them, well, then make time on weekends to work out. If patients say they work at night, I say, well, maybe either just before you go out to your work at night, that would be a good time to exercise when you still have some energy, because by the time you come back in the morning, you're going to be too tired to do anything. So it's just working with the patients and figuring out what those barriers might be, and then giving the patients advice on exactly what might be the best way to go about engaging in physical activity so that they can get the benefits that come from it. Mental health is a major barrier to good health, and taking care of mental health is particularly important to getting patients to do what they need to take care of their heart health. If patients are depressed, they don't want to exercise, they don't want to take their medications, they don't want to get to the doctor's appointment. People stress eat because they're depressed. In fact, American Heart Association has made mental health a particularly important focus for managing cardiovascular health. So now some of the things that we're supposed to screen for when we're screening for heart disease is patients' mental health, because we realize the importance of mental health in getting patients engaged in taking care of their heart health. It's kind of a multi-pronged approach to managing cardiovascular health at the policy and at the community level. It involves engaging multiple points, the policymakers, that would include the doctors, that would include the organizations, that would include the community leaders, and all of this will then make its way out to the people that are within the community to help manage their health. A lot of people in the Black community tend to listen to these community leaders, and then once they empower these patients with all this information, they can take that information to their doctor and say, can you help me address it? Big cardiovascular organizations like American Heart Association and American Cardiology can take charge of doing very important research that gives us information about what disparities are out there, what are the major cardiovascular issues that we need to address, what are the best ways to address these cardiovascular issues, and writing papers that eventually influence policy that improve these cardiovascular outcomes. If you know that is a problem before it becomes a major problem, then you can tackle it before it becomes a major problem, right? So if you know that you have high blood pressure ahead of time and you tackle them, down the stream, you can prevent all the badness, including heart attacks and strokes and heart failure and heart rhythm problems and the rest of them that occur as a result of these risk factors not being controlled. So controlling these risk factors is particularly important. All of us, every single one of us, have to be advocates for ourselves, right? The same way that we're advocates for our kids in school and for our community members or for our parents and that sort of thing, we should take charge of our health. My patients, they're taking care of all their family members, but they're not taking care of themselves. And I say to them, God forbid you should die right now. What's going to happen to those family members? Who's going to take care of them? So, just like on the airplane where the flight attendants would say, you have to put on your own mask before you turn around and put on even the mask of the child beside you or anybody else beside you. It's the same concept. You have to take charge of your health in order to be able to take charge of the health of your family members and your community or anybody else around you. So it's particularly important that you make your health a priority. I always tell my patients, write down all the questions that you need to ask your doctor, because what's going to happen is you're going to go in there, you're going to start talking about a topic, and you're going to completely forget whatever else you need to ask your doctor. If you're not sure that you're going to be very good about asking the doctor the question because maybe your mind is going to be all jumbled up because of what they're telling you, take a family member with you, take a friend with you. If you feel like you don't have a family member or friend that can come in, maybe they're busy, maybe they're at work or whatever, ask if it's okay to put them on the phone. Most of us will say it's okay. If you want to put somebody on the phone, put them on speaker. Let them help you navigate through that visit. And even after the visit is done, feel free before you leave to make sure that you know how to contact your doctor so that if you think about other issues, other problems, that you can still turn around and call or send a message the appropriate way to be able to get in touch with that particular physician. and make sure you have a physician that you trust. If it's a physician you don't trust, please move on. Find a physician you can establish a rapport with, because if there's no rapport, then you don't trust the physician. Then you're not going to do the things that the physician is asking you to do. And educate our community members and everybody else around you, your family, your community. Pass on whatever information and knowledge you have. One more thing, Blacks tend not to talk about their family history. Don't share their family history with each other. That is a major problem within the Black community. I can tell you this, my mom, now she's okay with me talking about this, my mom has had breast cancer a few years back. And she didn't want to talk about it with anybody. She didn't want to share that information with anybody. I said to her, what if your siblings are at risk? What if, I'm your daughter and I know about it because I'm a doctor? My sister needed to know about it too. All of us needed to know about it. If we as Black people don't share our family history with each other, we're only hurting each other. We're only causing problems with each other, because if we don't know what to get tested for, then we could have that same problem that our relative has had and has gone through that we didn't know about. So it's particularly important that we share our health history with our siblings, especially the next generation, our kids, our grandkids. They need to be aware of it because they need to know what to think about when taking care of their health. Think about it. Some of these kids that are playing basketball that drop dead, or any other sport, football, whatever it is, and they drop dead. It is possible that if a family member had shared some history with them, they would have gotten checked out properly to know what they're dealing with so that it doesn't become a problem, so that they don't die from it. So please share information and educate others around you. That's particularly important.